Once again, the American College of Obstetricians and Gynecologists is bringing together thousands of experts from around the world to discuss the latest in obstetrics and gynecology. Stay tuned as we will be covering key topics from the meeting, hearing from leaders in the field, and highlighting organizations working hard to improve healthcare for women. ACOG TV starts right now. COVID-19 has made us change the way we practice medicine. Let's take a moment to hear from a few experts on the updated guidance on COVID-19, pregnant women, and the vaccine, and what is being done to collect this critical data that will impact millions.
By March of 2020, we started just getting inundated with inquiries on the COVID-19, mostly related to pregnancy. And yet we had basically almost zero data, particularly around pregnancy.
We now know that COVID can be more severe in pregnancy. We know that COVID increases the risk of preterm birth, particularly among those with severe disease. We now know that COVID can be transmitted in utero, transplacentally. It's rare, but it does occur. And we now know that breastfeeding can be safe for COVID-infected mothers.
Pregnant women are at increased risk for severe morbidity and as well as mortality if they become infected with COVID-19 during pregnancy. And so that really has been part of the impetus to, really encourage pregnant women to seriously consider the COVID vaccine once it became available.
When a pregnant person is thinking about whether or not to get vaccinated, there are several important things to consider. First is her likelihood of infection. Is she leaving the house? Is she able to stay at home? Who else is in the household who may be going out of the house and may be at risk? What are the community transmission rates like wherever she's living or staying? Does she have other comorbidities? But really, for the vast majority of pregnant women, the wise decision is going to be to get vaccinated.
While it is true that we did not have pregnant women in the clinical trials, as of April 5th, according to the Centers for Disease Control vSafe app, we've had nearly 78,000 pregnant women that have received the COVID-19 vaccine, which is most likely probably an underestimate since most of them don't always sign up for the vSafe app. And yet, the side effects that have been reported in the vaccine adverse events reporting system maintained by the Centers for Disease Control have not shown any kind of increased risk compared to their non-pregnant peers.
The data that we're looking at now largely is in pregnant women who were vaccinated mostly in the third trimester and have now delivered. So ongoing pregnancies, we don't have as much information, obviously, but that will be captured with time. Pregnant women don't seem to have any more side effects than anybody else. But in addition to that, we have not found any pregnancy-associated concerns, like increased risk of miscarriage or birth defects or anything like that.
The Centers for Disease Control have a pregnancy registry that is in place that currently has about 4,200 women enrolled in it, and they are going to follow women throughout the entire pregnancy through various trimesters and then the infants up to 3 months. So I think this information is going to provide evidence on safety, immune response, and insights to even potential passive immunity for the neonate.
What has come out in the last, say, 2 to 3 weeks is actually some preliminary data in small numbers of women who have been vaccinated, mostly in the third trimester. That preliminary data suggests that those women actually develop robust antibody response to the vaccine, and that those antibodies then cross the placenta and are protective for the baby. At the moment, we do not know what the correlate of protection is in terms of what antibody response, but I think it's important to recognize that the vaccine seems to work like other vaccines that we use in pregnancy. That's always comforting to pregnant women to know that they're protecting themselves, but they're also potentially protecting their babies.
Right now, we're recommending that pregnant women get whatever vaccine is available to them. We do not have enough information, and luckily we don't have concerns about any of the currently available vaccines. I think as we learn more and more, the strength of our recommendation, for example, the strength of ACOG's recommendation to recommend the vaccine, will be strengthened. So right now we are offering the vaccine to pregnant women, and I think at a certain point we're going to be stronger in our recommendation that pregnant women get vaccinated, just like we recommend the flu vaccine for any person who's pregnant during flu season.
Let's continue our tour of organizations that are at the forefront of gynecologic research. Let's start today by taking an in-depth look at Pria Temp, where they empower women to make informed health decisions through science-based digital health technology, access to continuous data tracking, and community.
In the United States, 1 in 8 women have some difficulty getting pregnant when they do decide to start their family. Less than 20% of them are able to identify the fertile part of their cycle.
Pria is a new tool that uses continuous core body temperature to anticipate when ovulation is going to occur and then to confirm that it's already happened. The Pria system includes an intravaginal temperature sensor, which is a small flexible ring that collects temperature every 6 minutes for the entire duration of an ovulatory cycle, up to 29 days at a time.
Overall, patients have been consistent with telling me that it's extremely comfortable, it's effortless. We now know that it's very precise. It gives them a nice window of 2.7 days to plan when to get together and to try to conceive and maximize their chances each month of achieving pregnancy.
Next, let's take a look at UE Life Sciences, where they have developed the iBreast exam with a device that uses an electronic sensor, similar to a smartphone's touchscreen, to detect abnormal breast lumps as small as 5 millimeters. Cloud-connected and radiation-free, it allows healthcare workers to perform breast exams anywhere in minutes and without a degree in radiology.
Breast cancer represents the most common and most prevalent cancer in the world, and 1 out of every 4 cancers in women are breast cancer. The earlier that we find a cancer, the more treatable it is. iBreast exam is a handheld telehealth device that has been clinically proven to detect small palpable tumors without pain or radiation.
The iBreast exam device is based on a principle of tactile examination. Just like your fingers have pads and feel things, it can be learned without being a radiologist, and it can be applied by healthcare workers.
The iBreast exam goes to the smartphone and can be saved. It can also be accessed by experts for interpretation. The iBreast exam is more likely to find smaller masses than a routine clinical examination.
If I were on the front lines in a GYN office in a low or middle income country, on the front lines in a village, I would want at least this technology in my hands to help improve the accuracy of my screening evaluation of my patients.
Telehealth has exploded by need during the pandemic. The adoption of telehealth has been essential, and while there have been quite a few challenges with figuring out best practices, it has certainly opened the doors to a wide variety of opportunities that benefit the patient experience. Let's take a closer look.
Before the pandemic in about 2019, we saw that data demonstrated about 10% of the population of providers actually used telehealth, even though it was available. After the pandemic, depending upon what data you're actually looking at, it's up to 157% increase in telehealth utilization. So telehealth was propelled into use because of COVID. And in terms of gynecology, there actually is an opportunity to really address a lot of the common gynecologic issues that our patients are coming to us for help.
As a reproductive endocrinologist, I only see women in the first trimester, but the prenatal visits are a little bit different. We give women options of doing slightly less frequent visits than we normally would. And much of the time, instead of waiting for a physician, what the patient can do is come in early in the morning for an ultrasound and then schedule a telehealth medicine later in the day with a physician, so that there's minimal amount of time waiting in the office. And so we've been able to be very efficient and only do the parts that need to be done in the office, and then the parts that we can do remotely. The conversation, the consultation part of the visit, we've been doing mostly remotely, and that's been wonderful. Another nice benefit of the telehealth, especially during pregnancy and also for consultations for fertility, for example, is that while sometimes it's very difficult to get both members of a reproductive couple in the same place at the same time, with the telehealth it's been quite easy. One person can be at work, another can be at home. It's really given back a lot of time to our patients, I think, by being able to be so efficient and agile and offer these technologies really from anywhere.
You know, one of the really exciting things that we've learned about telehealth over the last couple of months, or I should say year now, is that it really has some very valuable utility in almost all of the services that we provide as OBGYNs. Telehealth really provides an opportunity for our new parents just having recently given birth to be able to talk with us, to see us, to share their experience in those weeks following delivery without having to navigate getting their new little one in the car seat or someone to watch them while they then make their way back to clinic to see us. It's really an opportunity to think about the many barriers that our postpartum patients face in trying to get back to us to ensure that they're continuing healthy lifestyles after they've delivered.
So preventative care during the pandemic, if you look at some of the data, it has decreased to a certain extent. There was, for a while, depending upon what part of the country you were living in, less colon cancer screening, less pap smears, actually pap smears happening, HPV screening happening. There was, though, an opportunity to continue with other non-physical exam preventive screening. The Women's Preventive Service Initiative guidelines actually are a wonderful resource that highlight what preventive screening should be done for patients, and many of those can be done remotely. Some of those include screening for anxiety, screening for alcohol abuse, smoking, and so the opportunity to do some screening for preventive care is actually there through telehealth. And when a patient needs to come in for the actual physical exam, then they can make an appointment to have that done.
We are now able, during the time of the pandemic, to really reduce folks' risk of COVID acquisition or transmission by keeping people out of the health centers. And we can do that now by mailing folks their medication abortion regimen. This is a huge win for access. I and others really look forward to this being a permanent change in the provision of abortion care, even after the pandemic. We have seen over the last year that we can still foster those same trusted relationships with folks via camera and telehealth, all while we are both meeting their healthcare needs and really considering and prioritizing access in the way that they need it.
Patients face many challenges when navigating their fertility treatment options, with costs and difficulty of technology like IVF set against the likelihood of success. A more personalized approach to counseling, giving people all the information available in a clear way, could vastly improve the experience of fertility patients and improve their chances of success with treatment. This is the aim of Unify AI. Let's take a closer look.
2.5% of children born in the United States today are a product of IVF. Patients care about taking a baby home. This entails a very complex conversation.
As a physician, our responsibility is to empower patients, and Unify is probably the best tool that we have.
Unify is a health technology company. We use artificial intelligence and machine learning to make fertility care more successful and accessible. Our flagship product is the Unify Pre-IVF report.
Couples understand the probability that going to IVF is going to result in a baby.
It's not just based on likelihood of success nationwide, it's based on our success here.
For many patients, this provides them the confidence to move forward when they otherwise might not.
Pre-IVF report allowed us to understand what was possible for us. It made us confident that we could have a child.
As we age, the production of hormones can be affected. Too much or too little of a hormone can have effects on the body ranging from moderate to severe. Biot Medical has developed a method that offers bioidentical hormone replacement therapy in the form of subcutaneous pellets. With more than 1.7 million insertions performed in the company's history, they've seen many lives changed with optimized bioidentical hormones. Let's take a closer look.
Biot has just changed my life. The best thing that have happened in the last 2 years for me.
It's so gratifying to be able to work with so many patients and so many practitioners that are really looking for answers.
Biot is the leader in hormone optimization because we're the only ones that have a proprietary dosing site that will dose testosterone and estrogen in women, testosterone in men, and thyroid in both.
I talk to women all over the United States, actually, when I'm flying, when I'm traveling, when I'm at a restaurant, if the opportunity is there, because I just think every woman should know about this.
Next, we got a chance to talk to ACOG's incoming president and another leading expert about how COVID-19 has impacted the uptake in recommended vaccinations in obstetrics. Let's take a closer look.
ACOG has had a long history of advocacy in vaccinations. About 15 years ago, ACOG established an expert work group on vaccinations. That work group has done tremendous work over the last 15 years as far as education of our fellows, education of patients, advocacy for vaccines in general. Many patients are hesitant to take vaccinations for a variety of reasons, whether it's a cultural reason, whether it's due to misinformation, whether it's just a patient choice. And especially during the pandemic and as we get into the major rollout of the COVID-19 vaccine, I thought that it was very important that we continue this momentum as far as vaccine advocacy, not only for the importance of everybody being vaccinated against COVID-19, but also administration of the more routine vaccinations.
There are two vaccines that are routinely recommended for pregnant women outside of COVID, and those are influenza vaccine as well as pertussis-containing vaccines. With the pertussis-containing vaccines, that's actually intended for prevention of pertussis in newborn infants. We have not seen an issue with that, and it's not surprising given the additional restrictions, right, on visitation and group settings and so forth. Influenza, on the other hand, is an incredibly interesting story because the incidence of flu across the United States has been really dramatically low. Masking probably not only prevents respiratory infections like COVID, but also other infections like influenza or even RSV or respiratory syncytial virus, which is a significant respiratory issue for young children. So we have not seen an uptick in any obstetric infections that are due to any changes in vaccination. But it is important that we continue to be diligent about that, especially as we see, public settings opening up for more access and gatherings.
I think it's very hard to say definitively how COVID has affected the uptake of other routine vaccinations. We do understand that the uptake of preventative care visits in general has been down during COVID. There was some concern that routine things like pap smears, like annual mammography and the like, that there was a decreased uptake of these preventative services. I think in general, the pandemic prohibited people early on from going to their doctor's offices because of barriers, access to those offices, perhaps just fear of engaging the medical system.
For me, what I try to do is make sure I'm talking to patients to help manage their expectations, but also to make sure people understand what happens in those preventive visits, right? It's really about making sure we maintain health during the course of pregnancy because that's the best way to ensure we have both a healthy mom and a healthy baby in the end. So we have done a lot to expand access through virtual visits like phone visits or televisits, through video visits and so forth. So I think it's really about making sure we communicate effectively, that we're responsive to questions, and that we continue to encourage individuals to say we are doing the best we can to protect you while you come in for any sort of preventive care visit.
Lastly, let's take a look at Agile Therapeutics, a forward-thinking women's healthcare company dedicated to fulfilling the unmet health needs of today's women.
Agile Therapeutics is it's an emerging women's healthcare company. We're dedicated to building a company, a therapeutic company, around identifying and hopefully bringing therapies for unmet needs for women and OBGYN community. Last year was an exciting year for us in 2020. Our first product got approved by the Food and Drug Administration was Twirla.
Twirla is for use in women of reproductive potential with a BMI less than 30 kilograms per meter squared, for whom a combined hormonal contraceptive is appropriate. Consider Twirla's reduced effectiveness in women with a BMI greater than or equal to 25 to less than 30 kilograms per meter squared before prescribing. Twirla is contraindicated in women with a BMI greater than or equal to 30 kilograms per meter squared. Please see boxed warning regarding cardiovascular risks associated with smoking and with having a BMI over 30, as well as other important safety information at the end of this video.
Well, that's it for us today, but we hope that you've enjoyed today's program. Make sure to tune back in tomorrow as we will have one more episode full of exclusive material from the 2021 Annual Clinical and Scientific Meeting. See you tomorrow.